Amid the COVID-19 pandemic, the flu season is fast approaching. Health officials are urging the public to get vaccinated as early as possible. 23 ABC's Bayan Wang spoke to health officials about why this is so important during the pandemic. He's joining us live from East Bakersfield with why public health officials say early vaccination is key. Bayan?
Yeah, Jessica, well, public health officials say getting an early flu vaccination is key for multiple different reasons, but the CDC says that the most important thing is that they have found that someone can contract both the flu virus and the coronavirus at the same time. They're still studying what the health implications of having those two viruses simultaneously is, but they did say the last thing a person wants to do is try to battle both those viruses at the same time. But regardless of that, hospitals are also urging people to get early flu vaccinations because they're not sure by December time, when the flu season peaks, whether they'd be able to take in an influx of flu patients while also dealing with the pandemic.
That is a busier time for us in the hospital because with flu comes pneumonia, comes some very sick people that end up being hospitalized more frequently than during the spring or summer season.
The spring and summer season slammed by the COVID-19 pandemic. The effects apparent in the healthcare system as hospital ICU capacity across the state has been a concern for months. According to Ken Keller, the president and CEO of Memorial Hospital in Bakersfield, the upcoming flu season will run between October and April, and this may pose a challenge.
We know that COVID is probably not necessarily going to be cured before the end of the year. And so the question that everybody's preparing for is, with the synthesis of COVID plus flu season, are we going to see a markedly, significantly busier fall and winter?
It's a question that has prompted hospitals across Kern County to examine the additional resources they'll need if there is an influx of flu patients. For now, Keller says 2/3 of his ICU beds are occupied, 9 beds currently with COVID-19 patients. He says this is a decline from the weeks prior, but the recent trend isn't something Keller wants to count on. He says what would really help is if the public gets their flu vaccinations early.
Our advice would be, of course, when that becomes available, take it.
Tim Callahan is the spokesman for Clinica Sierra Vista. He says medical centers are going to play a huge role in limiting the burden hospitals will face during the flu season.
We are the ones who can really intervene before it's too late. And with flu season, we can intervene with vaccinations and contact with your primary care doctor, i.e. flu testing, if you come in thinking of COVID, before they go to the hospital and overwhelm a system that's already strained.
And again, this upcoming flu season is expected to run from October through April. Most of those flu vaccinations are going to be available at various medical centers in September. Now, speaking of those vaccinations, the big question is whether there's going to be enough to go around, assuming that the demand is going to be high this upcoming flu season. According to the CDC, manufacturers are currently working to produce upwards of 190 million vaccinations, and they don't believe that distribution is going to be an issue. For now, we're live in East Bakersfield. Bayan Wang, 23 ABC, connecting you.